Frank is a 60-year-old male who was referred due to his poorly managed grade 3 hypertension. While his GP has prescribed medication, they are now exploring lifestyle strategies to support his treatment. Frank's primary concern is his stage 3 hypertension. To understand this condition, it's important to first explain what hypertension is. Hypertension refers to consistently elevated blood pressure above normal levels. Blood pressure is the force exerted by blood on artery walls as the heart beats, rising during contraction and falling during relaxation. It's measured using two values: systolic, the higher number when the heart contracts, and diastolic, the lower number when the heart relaxes between beats. Hypertension is defined as a blood pressure reading of 140/90 or higher. Over time, elevated blood pressure can damage arteries, making them stiff, narrow, and less elastic. This damage can lead to fatty buildup in the arteries, restricting blood and oxygen flow, and increasing the risk of serious conditions such as heart attack, stroke, atherosclerosis, and kidney disease. Blood pressure classifications are based on how high the readings are. The higher the numbers, the more severe the classification. Frank's readings of 175/83 places him just below the stage 3 threshold of 180/110. However, due to his medication and ongoing management challenges, he is still classified as having stage 3 hypertension. Frank's obesity, determined by his BMI of 34.7, indicates the presence of atherosclerosis, where fat and cholesterol build up in the arteries, narrowing them and increasing blood pressure. Addressing his obesity can help reduce his hypertension. Excess fat, particularly visceral fat, around his organs also raises his risk of chronic kidney disease. Reducing this fat would lower his risk of both kidney disease and further cardiovascular issues. Another comorbidity that Frank can be facing is chronic kidney disease. CKD is very closely linked with hypertension, as in the aforementioned paragraph, hypertension damages the blood vessels. This damage to the blood vessels in the kidneys impairs their ability to filter waste and fluid within the body. Not being able to filter this waste and fluid only increases the blood pressure, worsening the condition. If not treated, can lead to renal kidney disease. Frank is comfortable with his current routine, which includes occasional cycling and Pilates sessions twice a week. He has no experience with resistance training and doesn't use the weights or cardio equipment in the gym. Although he's apprehensive about high-intensity exercise, he's open to trying it if prescribed. His resting blood pressure of 175/83 is much higher than the optimal range of below 120/80. His resting heart rate of 55 beats per minute is lower than the normative data of 60 to 100 beats per minute. As Frank lives a sedentary lifestyle, this lower heart rate will be caused by the medication he is taking. Beta blockers will slow your heart rate to help lower blood pressure. His BMI of 34.7 is much higher than the normative data for a healthy weight of 18.5 to 24.9 BMI. His total cholesterol of 5.1 is in the range for healthy adults of less than 5.5. However, someone with a heart complication should aim for less than 4. His LDL of 2.2 is slightly above the normal ranges of less than 2.0, and his HDL of 1.0 is borderline, as healthy individuals should aim for higher than 1.0. The absolute contraindications for Frank would be if he presented to the clinic with a resting blood pressure reading of equal or over 180/110. Clients with a reading of this before exercise should be advised to see their general practitioner as a matter of urgency. The relative contraindications for Frank are if his blood pressure rises above 250/115 during a session. It indicates a hypertensive response, and the session should be stopped immediately and referred to his GP. Likewise, if his systolic blood pressure fails to rise by 20 to 30 or drops during increasing exercise intensity, this may suggest aortic flow obstruction, left ventricular dysfunction, or myocardial ischemia. If systolic blood pressure falls more than 10 below resting levels despite increased effort, the session should also be stopped and he should be referred to his GP. If a client is also experiencing other symptoms such as chest pain, dizziness, breathlessness, or extreme fatigue, the session will be stopped and the client will be advised to go see their GP. When looking at Frank's case study as a whole, it is hypothesized that Frank has reduced aerobic capacity, muscular strength, and a need for gradual, individualized, and progressive exercise intervention. Based off this, some of the additional testing batteries that will be completed are a modified Bruce treadmill test, a 10 repetition max strength test, and a DAS-21 questionnaire. The modified Bruce treadmill test was chosen to objectively assess Frank's cardiovascular fitness and estimate his VO2 max, tracking his aerobic endurance. It's also safer for individuals with hypertension starting at a lower workload to avoid an initial spike in blood pressure. Since the test only goes up to 85% of Frank's maximum heart rate, is a safe option for his condition. The reason for choosing a 10 RM strength test is because it is an easily repeatable test and will provide an objective measure of muscular strength and endurance for Frank. A 10 rep test has been chosen over 1 RM test as it is in a safer environment for them as by maximally exerting yourself for 1 repetition will increase blood pressure, which is a risk factor for Frank. The DAS-21 questionnaire was chosen due to Frank's history of depression. Although he feels in control, he'll be trying unfamiliar exercises. This tool measures levels of depression, anxiety, and stress, providing a score from normal to extremely severe. It offers valuable insight into how Frank is coping and helps guide the practitioner in supporting him. On arrival, the client's blood pressure will be monitored before, during, and after testing to ensure it remains within safe limits. This helps decide if the session should proceed and how well the client is tolerating it. Heart rate will be tracked throughout, and the Borg RPE scale will assess perceived effort to keep intensity safe yet effective. Any symptoms like dizziness or pain will be closely observed, as they may indicate underlying issues and impact whether the session continues. Frank is currently taking Twinster to manage his hypertension. Twinster combines amlodipine, a calcium channel blocker that relaxes and widens blood vessels to improve blood flow, and telmisartan, an angiotensin II receptor blocker that prevents vessel narrowing. Together, these help lower Frank's blood pressure and improve circulation. Frank has expressed that his goals in terms of clinical exercise therapy are to be able to exercise safely with his hypertension. Along with that, he expressed that he is wanting to improve his cardiorespiratory fitness along with his muscle strength. In the first 4 to 8 weeks, the short-term goals are to reduce systolic blood pressure by 5 to 10 through aerobic exercise, complete moderate intensity cardio without fatigue or significant blood pressure changes, and establish consistent adherence to a routine that includes resistance training. The long-term goal for 12 plus weeks is to manage Frank's hypertension, aiming to reduce his resting systolic blood pressure to below 140, significantly lowering his risk of cardiovascular disease. We also aim to increase his VO2 max from 31 to 35 to support his goal of improving cardiovascular fitness. Additionally, a 5 to 10 kilogram reduction in body weight is targeted to help improve blood pressure, reduce the risk of chronic kidney disease, and lower the chance of further adverse events. Frank has several modifiable risk factors, including stage 3 hypertension, obesity, depression, alcohol use, and inactivity. These can be reduced with exercise and lifestyle changes. A healthy diet, such as the DASH diet, regular exercise, and support from his family will help manage depression, while cutting back on alcohol can improve his blood pressure, weight, and mental health. A customized program with gradual guided gym sessions will help Frank gain confidence with weight training. Looking at Frank's non-modifiable risk factors, these include his age of 68 years and the fact that he is a male. These two risk factors cannot change, and as Frank gets older, he must continue to manage symptoms. The goal of Frank's personalized exercise program is to help him exercise more regularly and meet the guidelines for managing his stage 3 hypertension. As Frank currently leads a sedentary lifestyle, the focus is on incorporating aerobic exercise and resistance training to reach the ACSM guidelines of 150 minutes of moderate intensity aerobic exercise 5 to 7 times a week and 2 to 3 resistance sessions. This approach will strengthen his heart, increasing stroke volume and reducing the heart's workload, which helps manage hypertension. Exercise also promotes vasodilation, improving blood vessel flexibility and lowering blood pressure. Additionally, the increased activity will help Frank lose weight, which will lower his cholesterol and reduce the risk of atherosclerosis, improving overall cardiovascular health. Looking at the timetable with a view for aerobic exercise, the program will progress Frank to reach the ACSM guidelines of 150 minutes a week of moderate exercise. During the first 2 weeks, Frank will complete 2 30-minute walks, totaling 60 minutes for the week. During week 3, this will increase to 4 30-minute walks a week, totaling 120 minutes. By the 5th week, Frank will increase this to 2 45-minute bike rides and 2 30-minute walks throughout the week, totaling 150 minutes of moderate aerobic exercise. This gradual increase is to help Frank get used to his increased workload, build adherence, and lower the chance of injury. During the first week of the in-clinic resistance training sessions, Frank will undergo an extended warm-up of 10 minutes on an exercise bike to slowly build up his heart rate and to not cause any sudden changes in his blood pressure. Arm circles, leg swings, and torso twists have been added to incorporate dynamic movement into the warm-up to again aid in preparing Frank for his workout, minimizing the chance for adverse events. During the first week, Frank will complete a full body session targeting the major muscle groups to target an overall adaptation in increasing fitness and muscle strength. As Frank is new to the gym, these exercises are mainly machine-based open kinetic chain exercises so he can learn appropriate form whilst in a safe position. Frank will complete 1 to 2 sets, completing 8 to 12 reps at 60% of his expected 1RM or a score of 11 to 13 RPE. This is in line with the ACSM guidelines for resistance training with hypertension. Frank will also complete a few isometric exercises, as this has been seen to be extremely beneficial in hypertensive clients. By performing an isometric exercise while the muscle is contracted, blood flow to that muscle decreases. When the contraction is released, the big return of blood sends metabolic signals to relax the blood vessels, therefore reducing blood pressure. During the first week, Frank will perform 2 sets of 2-minute holds at 30% of max voluntary hold. If Frank cannot hold said exercise for the whole 2 minutes, they will be modified so he can. For example, if he cannot hold the wall sit, he can slide up the wall to reduce the difficulty and over the 8 weeks, slowly progress down the wall. Similarly with the warm-up, Frank will have an extended cool down on the stationary bike to slow his heart rate and reduce the chance for any adverse side effects and drastic changes in blood pressure. Static stretching of the major muscle groups used have been added to aid in recovery. By week 8 of the in-clinic sessions, Frank should have progressed and is much more comfortable and confident within a gym setting. Frank will have likely progressed to performing 2 to 3 sets of 15 reps for his major muscle group exercises. This progression and adaptations are important as this is Frank's goal. Furthermore, Frank's isometric exercises will have now progressed to the recommended guidelines of 4 sets of 2-minute holds with 2 minutes rest. As he has now had 8 weeks of structured exercise, this should be achievable. The intensity of these exercises will stay the same, as it is important he does not exceed the moderate intensity, as this can cause various complications. However, Frank should be able to increase the weight and number of reps. This is now in line with the ACSM guidelines for resistance training for someone with hypertension.